So this is a research collaboration or alliance between AstraZeneca Pharmaceutical and the University of Virginia. We are going to, the main funding will actually go to funding projects for identification of new therapeutic targets for treatment of cardiovascular disease, mainly myocardial infarction, atherosclerosis, and peripheral vascular disease, but also work on aneurysms. We're very excited about it in that there will be a principal investigator at UVA and also a principal investigator with appropriate expertise at AstraZeneca. Thus, both entities can take full advantage of the resources and unique talents and skills and other infrastructure that they have at their disposal. For UVA, we're particularly attracted because AstraZeneca has much more experience in actually taking basic research findings and translating them to a useful therapeutic product. And so we hope to greatly enhance our translational research capacities to benefit patients through this alliance. As part of this program, we're also going to exchange scientists at all levels, so principal investigators as well as graduate students, fellows, and postdocs. AstraZeneca has already identified an individual, this will be a later announcement, who's going to spend at least 12 months on site at UVA helping to foster the collaborations in the initial group of projects that are funded. In addition, UVA will be sending individuals to AstraZeneca as needed or appropriate where it can enhance the progress of the research. And many of our graduate students and postdocs are particularly excited about doing that. Those will probably be, rather than for a full year, will probably be on the order of 2 to 3 months or shorter. To my knowledge, this is the largest scale collaboration that the University of Virginia has had with a large pharmaceutical company. We've been part of, testing of drugs for various pharma, but this sort of open-ended drug discovery, target discovery sort of project we've never had. So this is really very exciting. AstraZeneca did look at every institution. They were looking for one partner in the cardiovascular area. What initially attracted them to us is the breadth and depth of high-quality cardiovascular research programs we have here at UVA, which are organized under the Robert M. Berne Cardiovascular Research Center that I direct. So that's what initially attracted them here. Upon visiting us, they were particularly impressed, they said, their words, with the leadership and the collegiality of investigators at UVA, that we really did collaborate, and they felt since we were good collaborators with one another, that would be a good partner with them. And they felt that we really stood head and shoulders above our competition, which were among the most reputable institutions in the country. So my role will be to ensure that the projects that are chosen for funding are showing good progress. One of the differences with this type of funding is that we focus on milestones and value building on a much shorter time scale than a standard NIH-funded grant, where we often think of progress in terms of years or multiple years. We're going to have quarterly meetings of all the PIs and associated investigators with these projects, where we'll review the progress and look at whether or not we're value building in terms of the funds that are being expended. The grants that will be awarded will only be for 1 year at a time. So if a project is not progressing, it won't be continued. And we look to fund at least 9 to 10 new research projects per year with this program. The milestone value building sort of model is something that our industry, large pharma, and biotech startups emphasize. So I think developing that culture to augment and layer on top of the outstanding academic research environment that we have will benefit everyone, including patients getting new therapeutic agents that can benefit them much quicker than might occur without this sort of alliance. We're able to set these milestones, so a very important part of the review process wasn't that the PIs wrote a grant and then there was an evaluation and then a decision made without further PI input. So the PIs were given an opportunity to respond to an initial review of the grants, both in writing to a list of questions about the proposal, but also in a teleconference. So the projects are actually able to evolve to more closely fit the mutual interest of both groups. And that's fundamentally different than the NIH review system, where grants go off and about 9 months later you find out whether or not you're going to be funded. And if there was a slight misunderstanding, but a fundamental misunderstanding, you might have to go through another 9-month cycle to correct it. Here we did that in a period of 2 weeks. So that's an example of how we're going to really, through close communication and collaboration, accelerate the rate of progress. You know, we're very excited to work with AstraZeneca. I've visited their site where their cardiovascular division is in Gothenburg. The company has a great culture. I can see why collegiality was very important to them. Among a lot of large pharma companies I've visited, I've actually been most impressed with them in terms of the skills that they have and their willingness to really open up and let us know what is going on in their company so we can better match that to UVA. So we're extraordinarily excited about this for both UVA, for the Cardiovascular Research Center, and for AstraZeneca, because I think it will prove to be a very productive long-term partnership with UVA that I hope will extend far beyond the 3 years of the initial agreement.